The Minnesota Department of Health has released a new report on adverse health events, and there's good news. The total number of events rose by the smallest margin since before the pandemic, even as hospital stays continue to lengthen. We'll hear more about patient safety coming up. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm your host, Tim Nelson, and I'm joined today by Jenny Schoenecker, Associate Vice President of Quality and Safety at the Minnesota Hospital Association. The latest state report on adverse health events noted a small rise of total incidents from 610 to 624. The number of serious cases did not rise last year, even as Minnesota is coping with more acuity, longer inpatient stays, and growing surgery volumes.
The 2025 version, which covers a reporting period of October of 2023 to October of 2024, shows that we did see a slight increase in the total number of events that were reported. And with that, while we don't like to see an increase in events reported, we do know that transparency is important, and so we do encourage reporting, and we encourage a culture of quality and safety. And so when events are reported, we can learn from them and try to prevent events from occurring in the future.
So some of these numbers may be just a matter of better record keeping and better tracking rather than reflecting conditions in hospitals themselves.
Right. We have been really working hard on establishing a culture of safety in hospitals and health systems across the state. And with that culture of safety is transparency and really encouraging our employees and healthcare workers to report when there's an event or a concern or even a near miss or a good catch, because that's how we learn and improve our systems.
Now, I know the state has been doing this report for decades now, and obviously it's not just the same healthcare and hospital industry, it's a different patient population as well. I saw a story in the Associated Press last week that said, for instance, Americans more and more are dying of accidental falls. So there's something going on in the population as well, correct?
Yeah, we are seeing patients that are sicker, they're frail, their acuity is higher, they're older. So the patients we're taking care of, yes, they are. There are more co-occurring needs that they have when they come into our hospitals.
And how would that play into adverse health events?
Well, we are taking care of patients that have more needs. They might be taking more medications, having more procedures performed, using more types of devices in their healing. And so all of those things really contribute to the overall status of the patients, making them more complex. And unfortunately, sometimes that can lead to various adverse events occurring.
Now, I know Minnesota was a pioneer in this effort in tracking these things. This has been going on for several decades in our state. How does this compare to the rest of the country? What does it look like in other states?
Minnesota was the first state to have an adverse health events reporting system, which highlights our commitment to transparency and to learning and growing. Other states have types of reporting systems. They're not all the same as ours, and not all states have a reporting system at all. But because we've had one for so many years, we've learned a lot, we've collected a lot of data, and we are committed to using the information we have and continuing to improve patient safety.
So this is something you literally make a living doing, is tracking and improving these numbers. What are you seeing out in hospitals? What are they doing to address these events?
Well, there's a lot of work that is happening in Minnesota hospitals and health systems to prevent adverse events from occurring and to respond when they do. We are using a lot of different innovative technology to help us predict when a patient might be at risk of some sort of event occurring. We are doing a lot of training a lot of simulation type exercises, and we are making safety a priority in all of the work that we're doing.
I know I talked to an executive from a company, Care AI, one of our endorsed business partners, that's part of what they're doing here. They're developing cameras that, for instance, can help spot people that may be trying to get out of bed, that may be at risk for a fall. I know that there's that AI is making some improvements in medication tracking, things like that. So there's a lot going on in there. What about the people themselves? I know this is part of education, part of training. What does it look like for the people?
Yeah, there is a lot of training that happens in the hospitals and health systems, both at the bedside and in a classroom type environment. There's also a lot of different simulations our hospitals are doing to give staff the opportunity to practice responding to an event or preventing certain types of events from occurring. So it's really about keeping the eye on safety and supporting our healthcare workers and frontline staff who are working with our patients on a day-to-day basis to equip them with all the tools that they need to be able to provide safe care.
And I know this isn't just happening in hospitals. I know that you have a lot of events and gatherings and activities throughout the year aimed at improving these numbers. Tell me a little bit about those.
Yeah, I think that's something that we should be really proud of in Minnesota, is the fact that we have representatives from hospitals and health systems who come together on a regular basis to work on safety initiatives. And they do so in a manner where they're willing to share with each other, they're willing to learn, and really just come together as a state to do everything we can to provide the best and safest care we can. So we come together through MHA committees. We come together through different working groups to address specific types of adverse events. We also have conferences, in-person conferences, virtual conferences, and we have really excellent participation and engagement in that work.
And my last question here, I guess, is it working? How does Minnesota compare to the rest of the country in terms of quality and safety?
Yeah, in terms of quality and safety, Minnesota is ranked amongst the top, and we have been for a long time, and our goal is to continue to remain as a top performing state when it comes to quality and safety. But because adverse health event systems vary from state to state, it's really hard to compare. But we do have different resources that look at specific quality and safety measures, and we do rank amongst the top.
Well, I hope that continues to improve. Thanks so much for your time today.
Thanks, Tim.
That again was Jenny Schoenecker, Associate Vice President of Quality and Safety at the Minnesota Hospital Association. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.